Thank you. Dr. Taylor, did you want to come back in briefly?
Helpful, and we're obviously very grateful to OTE and physio and everything for what they do. I just wanted to say something about the pathophysiology of long COVID and the rehabbing of it. So long COVID, I'm not sure most people know what it is. They think they know what it is, but they don't. And it is a vasculitis. It is an inflammation of the blood vessels. Every part of your body has a blood supply, and that's why it's a multi-system disease. The immune system isn't working properly, it's overactive. So a bit like people have autoimmune disease, when people try to do things, their immune system activates and they feel like they've got flu, for example. And when you have a vasculitis, usually, so there's other forms of vasculitis, and we know this about COVID because there's thousands of research papers. When you've got a vasculitis, usually you're under a whole team of people, like the OT was saying, an MDT, but you would never try to rehab somebody with vasculitis without giving them treatment. And that is what's missing. And we have to always go back to the pathophysiology to look at what the condition is. And then there is a spectrum of mild disease up to severe, but the pathophysiology is poorly understood by most people, and it is a vasculitis. And it is worth reading up further on what a vasculitis is. And only once we target that, and there are studies ongoing, there's a study down in England at the moment, Stimulate ICP. Once we target that, that is when we will probably be able to treat people and rehab people. And so it's just a reminder that this is not a psychological disorder. This is not, thinking yourself better or, having, positive thoughts. This is a medical condition with roots in the blood vessels. And long COVID is canaries in the coal mine, because the increased risk of an MI after COVID is 50% for 18 months afterwards. That is a stunning statistic. And the canaries in the coal mine are getting symptoms of long COVID. The rest are not, they are just having the heart attack. With the same pathology underlying it. And again, we know that there are hundreds of studies. But grateful for all of the MDT and everybody. And I wish I had a whole MDT here with me, but I don't. But it's just a little bit on the pathophysiology, and we don't usually rehab people untreated with these sort of diseases. Thank you. I'll be quiet.
I think we've got time. I think Jane Claire Judson, you want to come in.